Good morning. Thank you for joining us on an important day and a very important mission for the state of Washington. Here in our state, we continue to mourn our lost loved ones, and we continue to thank the thousands of people who are working to slow this epidemic. And we'd like to thank actually 7 million Washingtonians, because Washingtonians are all pitching in on this. They're all being leaders in the things that we can all do to fight this epidemic. Now, Washingtonians are not going to work when they feel ill. They're washing their hands repeatedly. They're maintaining social distance as appropriate. Handshaking is so yesterday. We're now doing the elbow bump. And we are protecting our loved ones who are of a certain age or who have medical conditions, and remind them that this is not a time to be exposing themselves to large groups of people in confined spaces. I'm pleased that Washingtons, I think, are pitching in to do all of these things, and these are the most important things we can do, because our best weapon against this epidemic is smart individual decision-making to reduce the interactions of people in which this transmission can occur. And so I want to just show my appreciation for Washingtonians being united on this in a common cause and realizing we're all in this together. As of last night, we've had 162 cases, presumptive cases that in the preliminary test have been positive, and 22 deaths as a result of the virus. The virus has now expanded to 8 counties throughout the state of Washington, both in western and eastern Washington. Obviously, we continue to do all we can to protect all of our residents. Today, we're announcing some measures we're taking to help families who will have some economic dislocation or would otherwise have that dislocation, but for the measures we're taking to give those families additional economic security to deal with this issue. Today I'm joined by Susie Levine, Commissioner of our Employment Security Department, Franklin Plaistow, Assistant Director of State Human Resources, and Cheryl Strange, our Secretary of DSHS, Department of Social and Health Services. As you know, early this month I issued an emergency declaration directing state agencies to use all resources and explore all options to prepare for this epidemic. And one way to do this, and perhaps maybe the most important way to do this, is to protect our aged adults and those who have underlying medical conditions. So we want to address what we're doing today for our nursing homes and our long-term care facilities. The risk of severe illness and death from COVID-19 clearly is higher for members who are of our communities who are over 60 years of age and those with chronic health conditions. Fortunately, probably 80% of the people who have this virus will only have mild symptoms, but we know that this is a fatal disease all too frequently for those particularly of age and those who have chronic conditions. And we also know that an increased risk of rapid spread of COVID-19 among persons who are living in congregate settings, such as long-term care facilities, and most residents of long-term care facilities are at an increased risk of this virus. To that end, Secretary Cheryl Strange and I are urging compliance with the following in nursing homes and assisted living facilities, and these will be requirements. Number one, we are requiring compliance that residents are limited to 1 visitor per day. Visitors must be adults, and the visit must take place in the resident's room. This does not apply to end-of-life situations. Number two, all visitors must follow COVID-19 screening and follow reasonable precautionary measures. Precautionary measures might include, but are not limited to, wearing personal protective equipment, social distancing, or visiting in designated locations. Number three, all visitors must sign into the visitor's log, and owners and operators must retain that log for 30 days. Number four, employers or volunteers must be screened, that's not testing, but screened for COVID-19 symptoms at the start of each shift. Number five, people living in nursing homes or assisted living facilities who are under a recommendation or order of isolation or quarantine from the Department of Health or local health department must be isolated in their rooms away from other people. Number 6, owners, operators, staff, and volunteers are prohibited from disclosing protected and confidential health information except as otherwise provided by law or with the consent of the resident. We are doing this to protect our patients, obviously, their families, and people who care for them. We also know that when cases develop at these long-term care facilities, families and public clearly have lots of questions and high concern for their loved ones. Sometimes the real need for that information can overwhelm the staff's capacity to answer legitimate and important questions in a timely fashion. So the Aging and Long-Term Support Administration under our DSHS will contract with a case management entity that would work directly with facilities to provide real-time information to family members who are authorized to receive it. The administration will also have a web page ready early next week that could provide us up-to-date information as possible regarding these facilities. I believe this is going to substantially avoid the situation that we had in Kirkland with many families having such high anxiety about their loved ones. I do want to share with you that last night I spoke to Seema Verma, who's director of our Medicare and Medicaid entities federally, and she told me basically top-line results of the survey that the federal regulatory agency, this is the group that looks at the quality of care in these facilities, and she will have to release the survey when they can, but I can tell you in listening to her and when those survey results go out, I believe families will be comforted and reassured about the medical care that their loved ones have. It was very pleased to hear what I heard from the people who've gone in and actually look at the quality care of the nursing home. I want to talk about our unemployment insurance benefits. We are looking for multiple ways to give families confidence that they're going to be able to get through the hardship this has imposed. Commissioner Susie Levine is joining me today to announce new rules to help alleviate the economic impact felt by businesses and workers. We appreciate the businesses have already stepped up to accommodate workers who may be impacted by COVID-19. But I've asked Susie and directed our agency to look at all the things we can do to widen the safety net for people who are in this situation of either having illnesses or having to be isolated. Whether it's businesses expanding their paid and telework options or support for state workers, unemployment insurance or paid family and medical leave, we can help provide individuals with additional security while they care for themselves and their families. And I'm very proud of our state that we have probably the best security system for families regarding paid family leave and paid medical leave in the nation. In this case certainly shows the wisdom of having been robust in those plans. So we can help businesses weather the outbreak and employees. And the Employment Security Department developed emergency rules that went into effect early this week. These rules enhance the flexibility of the unemployment insurance program to give high confidence that people can use this if in fact they're ill or isolated. The first and best option for an impacted worker is employer-sponsored paid sick leave under our state law, and I'm proud of that law. These additional rules are designed to provide a backstop for the vast majority of workers who do not have access to employer-sponsored paid leave. And they will help relieve the burden of temporary layoffs, isolation, or quarantine by ensuring unemployment benefits are available to individuals whose employment has been impacted by COVID-19. These new rules will ensure the following. Workers will be able to receive unemployment benefits, and employers will get relief of benefit charges if an employer needs to curtail their business or temporarily shut down operations due to these problems, or because a worker becomes sick and other workers need to be isolated or quarantined as a result of the virus. If a worker falls seriously ill and is forced to quit, they may qualify for the paid family medical leave while ill under the existing program. Once recovered and available for work, they may apply for unemployment benefits. Next, we are providing leniency to businesses and individuals affected by COVID in their timeliness for financial penalties for late payments and information that is due. We're also allowing businesses using standby to include their part-time and less than full-time workers. I want to address our state employees. I'm also announcing steps today that will help those who work for the state and are impacted by COVID-19, including expansion of leave and telework options to all state employees. Franklin may have answered any questions you have specifically, but I'll go through this quickly. This morning I sent a letter to our state employees and I laid out these additional options. First, telework. State organizations will explore all possible options to expand telework to employees impacted by COVID-19. Next, we're expanding leave. State employees impacted by COVID-19 and required to self-quarantine or isolate under CDC guidelines will be permitted to stay home and pay if they're unable to telework for up to 14 days. Next, guidance around staying home and self-isolating. I will continue to ask state human resources to continue to monitor instances where our leave programs can support our employees and our families. I'm grateful for the fast action of our state agencies in responding to my emergency order. Together, these policies will help protect older workers, adults with problems, their families, and caregivers, as well as workers and businesses. Now, I just want to make a general comment. The suite of these policies are really going to help people weather this economically. And we're pleased to be able to expand this economic security net. But we have to realize we have a long road ahead of us. And we're going to be asking Washingtonians to step up to the plate to help all of our communities. And some of these things are going to require disruptions in our common way of doing business. And I just wanted to share with you and the public some information why those disruptions may be necessary. The best assessment we have from our epidemiologists, and we have spent hours and hours looking at the science on this because we're a science-based state from around the world. I've spoken from everyone from Anthony Fauci, the director of the National Institute of Allergies, Trevor Bedford, our excellent researcher at Fred Hutch, Dr. Bruce Alward, who's a senior advisor at the World Health Organization, and Dr. David Nabarro of the World Health Organization. We have searched the world for the best science on this. And I'm going to summarize what our state has been able to find. We have 162 presumed people whose test results have shown that they have the virus in Washington state. But unfortunately, since we haven't tested 7 million Washingtonians, we know that there are many, many other people today in Washington state who have the virus, who've not been diagnosed and may have no idea, may have no symptoms at this moment. And there is a range of that number, but the number I use is about 1,000, and it could be a lot more than that, frankly. Here's the problem and our mission. We need to look forward ahead of the curve in Washington state. If we're going to stop this epidemic or seriously slow it down, we need to look at what's coming in Washington state, not just as what is here today. Now, if we assume that there's 1,000 or more people who have the virus today, what the experts are telling us is that in an epidemic like this, looking at the characteristics of this virus, the number of people who are infected will double anywhere from in 5 to 8 days. So the number of people who are infected in an epidemic like this will double in the state of Washington unless we take some real action here. And if you do the math, it gets very disturbing. When something doubles every day, it gets to a very large number very quickly. So if there are 1,000 people infected today, in 7 or 8 weeks, there could be 64,000 people infected in the state of Washington if we don't somehow slow down this epidemic. And the next week, it'd be 120,000, and the next week, it'd be 250,000. So this demonstrates why we have to consider all of us in our family activity, our individual activity, our institutions, that we need to take action today looking forward, and that's what we are doing.